Hello and welcome to Nursing Webinar Series. Myself, Shanti Bhattacharya, the Vice President Nursing from Yashoda Hospitals. First of all, we wish all our viewers a happy and healthier new year. I hope many of you have made resolutions and let us not to forget, keeping this fitness and learning as our prime resolution. Having said so, today the topic which we have selected for today's learning is robotic assisted bariatric fundamentals. We are only going to talk about the fundamental parameter. And as for this, we have our expert, Dr. Kona Lakshmi Madam, who is our consultant, minimal and robotic GI surgery and metabolic and bariatric surgery specialist from Yashoda Hospitals, Somajiguda. I welcome you, ma'am.
Hello and Happy New Year to all of you once again.
Thank you, ma'am. And as we go with the first slide, like as you can see the abdominal girth of the patient and this to crafted pot, like, and the first insight we would like to understand from you is obesity the real pandemic of the century now?
Yes, obesity is the chronic pandemic of the present century. We have seen how much the acute pandemic COVID caused so much havoc.
Yes.
The equal amount of havoc obesity is causing. And we don't know, countless number of people are falling prey to this disease, obesity. Obesity is a disease. First, we have to accept that obesity is a disease.
Yes.
And you see the number of people having metabolic problems like diabetes, type 2 diabetes, cardiac events, high blood pressure. So many joint surgeries are being done. Why? Because obesity is damaging their joints. And a lot of people now using CPAP or BiPAP at night because they are not able to breathe properly at night.
Yes.
That is what we call obstructive sleep apnea.
Apnea.
We are seeing a mushrooming of fertility centers. Why? Because this obesity is causing PCOS and infertility. So much damage and so many people. Now you see again the number of people dying young has increased. In spite of the best medical services available, we are seeing a lot of people again dying young. All this is because of obesity and the metabolic syndrome.
So going forward, we will also understand, like, this is one of the discussion when I was having with my Dr. Pavan Garu, who is our MD and director from Yashoda Hospital. Like, as he said, Shanti, why don't you ask what is about robotic surgery from the nurses? So this is like, what do nurses think about robotic surgery? Having his idea, so we thought we will just have this, run this series as a, training program for them. I'm sure we should learn and we should also teach it to the nurses. So when randomly we were asking the nurses, I think, madam, you will be surprised just to understand. And not only nurses, even paramedical staff also. A nurse who was, little senior and from one of the XYZ unit. She said surgery is done with the help of machinery instruments. Back-end surgeon handles it. Okay, well and good. Partially she was all right, and whatever she gave little answer. Now, second nurse who says the patients are operated by robots. Then the third nurse says the robots like instruments in OT operates on patients. And few nurses said no idea about this. And one more nurse said, like lab procedure, small incision will be done and the patient will get recovered. So I know these nurses are nurses, paramedical, non-medical staff, if at all. They had this kind of robots in their, fictionary mind. So to clear their myth and facts, so we are trying to give them little fundamental, parameters today. So again, ma'am, fact versus fiction. So this we would like to even understand from you. Do people commonly think that robotic surgery is performed by autonomous robots? You may get to hear, ma'am, when they come to you and you give them the option of the surgical interventions. So what do you hear?
Yes, yes. They say, no, machine. You only do our surgery, no? They'll say. And they say, why you want to leave it on a machine to do? Then we say it is not using, letting a machine do and I sitting in my OP and, huh? seeing a
Yeah.
movie or something.
Okay.
It is, I only have to do the surgery, and this is a more advanced tool that is helping me to do whatever surgeries I'm recommending to you in a more better way. So I give them some comparisons like driving a manual car and a automatic car. I
Yes.
say, you see now automatic car, one pedal and everything gets adjusted.
Yes.
But in manual car, you have to think 10 times. Oh, which is the clutch, which is the gear, I am pressing on the brake
Yes.
or the accelerator. You think so many things.
Yes.
So same in laparoscopy, when we are doing, I have to see how the person is holding the camera. Is my assistant holding properly? Are they clashing with my instruments? In robo, it is not like that. It is
Okay.
one single platform, like your first nurse who said no, that
Yes.
all the instruments are attached to one platform and then you do the surgery. So actually, robo, see, I will say crudely, you see, now you see the JCBs on the roads.
Yes. Yes.
Right?
Yes.
So they take down buildings, they remove big boulders so easily. But have you seen the person sitting inside? He's
Yes.
hardly small person. That
Yes.
person will not be able to lift one 10 kg bag also if you see the person who is driving the JCB. Okay, but the JCB is doing so much work. That is the crude form of a robo. That is also a robo.
Yes.
So that robo is a advanced mechanization. We can say that is machinery for us, instrumentation, all same thing.
Yes.
Where with one handle, movement of a handle, you are able to do the difficult task.
Yes.
So ultimately, who has to do? That individual has to do. But when technology helps you to do that procedure or work easily without putting lot of stress on your general system,
Yes.
that is called a robotic surgery.
Yes. And ma'am, again, is it AI, artificial intelligence guided, alignment? Like,
Yeah, when you artificial intelligence does not guide the surgeon, okay,
no,
guides
no.
the instrument.
Yes.
So it actually, if 100 of us stand with our arms stretched out, you see more than 50% arms will be trembling like
Yes,
this.
yes. It will be
So
trembling.
there will be a fine tremor.
Yes.
Everyone will not be able to stand with their arms
Yes.
stretched out,
Yes.
even for few minutes. Understand, you have to operate on a patient with your arms stretched out, handling instruments. So
Yes.
there will be a fine tremor.
Yes.
So the AI in this cuts down the tremor.
Yes.
So even if the surgeon's hand trembles a little, the AI fine tunes the tremor, and there the instrument don't shake. But in laparoscopy, for some surgeons, you can see that when they're operating, the instruments will be tremoring like this. So
Yes.
that is reduction or abolition of the tremor. That is where AI works. Okay, and then magnification. You get magnification. That is also depending upon the organ you are seeing. If you
Yeah.
see liver, a big organ, 1.5 kgs. If you
Yeah.
see 10 times magnified, it is like you are seeing a mountain. No, there the AI will curtail it. How much you should get a real time image. Small micro blood vessel, you will see it big. So that is the difference. Even though you have magnification, we think just it is like taking an ordinary magnifying glass and seeing. No, the
No.
AI will downscale. Liver should look like this, blood vessel should look like this, nerve should look like this. So
Oh.
that is where the AI information is fed into the system so that everything looks real time to us.
And it is something like targeted pinpoint surgery
Target, you
intervention.
have to ultimately reach the target.
Yes.
Robo can
Yes.
take you there. But
Yes.
reaching that, it will tell you, oh, this is a big organ, this is a small organ, and this is the blood vessel. It looks like this. So you can see with more clarity than a naked eye or
Yes.
than a laparoscopy.
Yes. So there are two things again, robotic assisted surgery, and many of us do not know what is the term refers to bariatric. And I think being as a bariatrician, you should only, you would explain us what is, bariatric surgery. This slide.
Yeah. So normally when a person, individual starts putting weight, ideally they should put lot of effort with the diet and exercise and lose it.
Yes.
But some people miss the bus. So beyond a point, that obesity or the fat starts working as an independent endocrine organ.
Yes.
And the fat starts producing chemicals or hormones which will cause a alteration in your metabolic rate.
Yes.
So, and that causes you to gain weight more rapidly.
Yeah.
Because you will hear a lot of people saying, I'm not eating anything, but I'm putting on weight.
I keep saying that.
Yes, most of us feel that I've not eaten that much, but my weight is just okay. So that is because of the chemical change. Now, once the chemical change sets in, then the fat acts as an independent thing. So it only thinks about making more and more fat. So when we do bariatric surgery, we do bariatric surgery for such people
Yes.
where they're so obese. Now that obesity becomes a life threat for them. We have already discussed that
Yes.
people are becoming diabetic, hypertensive, cardiac problems, all this because of the chemical change this fat is causing. So if we can tackle that chemical change, we can bring about a reversal in part of the damage which has been done,
Yes.
which also includes getting a weight loss.
Yes.
So the chemicals counteract this fat induced chemicals all come from the intestines and the stomach. So by reducing the stomach size and bypassing certain segments of the small intestine, we are able to generate a chemical change which can tackle the bad effects of the chemicals produced by the fat. That is bariatric surgery.
So there are also a lot many types, but in the next series we would discuss about the types of bariatric surgeries in very simple, understanding. Now, ma'am, again we are, going a little bit fact from fiction. Again, rising RABS like robotic assisted bariatric surgery. Is this surgery experiencing significant growth in the coming years? I think already it is in a emerging practice and it is booming very well. And I keep seeing you doing a lot of surgeries. And what is your take on this, ma'am?
Yes, when we started doing laparoscopic surgery, that is almost 2.5 decades back, when
Yes,
across the world laparoscopy or a minimal invasive surgery boom happened,
yes,
we saw that for certain procedures there was always a certain degree of difficulty.
yes,
So that difficult part either needed a lot of experience and the individual skill and effort,
yes.
or people were saying that after this point we are not able to do it, minimal access, we are opening the patient,
Oh,
because they were not able to tackle that critical steps, not for so many reasons. Over time, lot of instruments were being made to get over those difficult steps, but still always the difficulty was there. Like for, I'll say, for a very obese patient, someone who is very obese, your instruments are, lap instruments are 5 mm. You
yes,
can increase the length, you cannot increase the width. Okay, so the instruments used to bend, so that if once the instrument bend, that control on the instruments becomes less. You're trying to hold something, it may slip off. It could be a blood vessel, means the patient can bleed.
yes,
Okay, you're trying to join two things together, you're trying to stitch two intestines together. So your needle holder is not able to drive the needle properly. So these are the problems which we were facing, and somehow we fought and fought and fought and tried to do things. So the instrument makers or the companies who put research into making the instruments tried to get us more sturdy structure
yes,
which can actually handle the complexities. This can handle the patient's obesity, can give us more vision and make us navigate the narrower points or the narrow parts of the human body where too much of instrumentation or too much of visualization was becoming difficult. So
yes,
if I can say, if I give you for your lunch or dinner 5 different types of forks, knives, and ask you eat.
Yes.
Then
Yes.
definitely you have seen 2 or 3 spoons or forks will fall down from you
Yes. Yeah. Too
hand.
many
Okay,
things in one.
too
Yes.
many things.
Yes.
If I give you one instrument or one instrument or one what we can say cutlery,
Yeah.
which can do multiple works,
I mean, we would opt out for that.
we'll opt out. That's
The single
how
item.
robo. That is
Yes.
how robo.
Yes.
So robo is the answer to the surgeon's prayers.
Yeah. Oh,
That
that is a
uh,
very beautiful statement I
something
could hear from
give
you
me
today.
something
Yes.
which helps me navigate the difficult steps and help me to complete this surgery in the same minimal access way rather than opening the patient, because opening the patient is such a painful thing for the patient.
Yes. Yes.
We can complete the surgery, no this thing in that, but later the patient has so much pain, wound
And length
infections,
of stay is
hernias, everything
increasing, all
happens.
that. Yes.
So that is an answer to the lot of surgeons prayers, that robo.
Good.
So
Good.
robo is a helpful tool for us.
So I think I'm sure all bariatric surgery, not only bariatric surgery, all other specialty surgeons are very happy doing performing on robots,
Yes,
performing with
we are
this
very happy.
robotic. Yes, and yes, better, very great patient outcomes also we are experiencing. Yeah. And again, when we talk about the fundamental advantages of robotic assisted bariatric surgeries in simple terms, I think these slides, as you were discussing, minimally invasive, precise, because the dissection and cuts are very, very to the point. And I think, ma'am, I would love to hear from you as you spoke about the magnifications. And I think this, features, the organs are displayed in this high definition 3D camera. If I talk about wide angle view, and if at all we talk about the robotic system, like when I'm just going forward for this, so what we saw, the previous slide, this is how you sit here. This is your
Yes,
console computer, and my question would be, or the interesting fact would be, like here you get to see what has been displayed here.
yes,
This one. And the
yes,
patient table is here, the nurse or a total number of, people scrubbing and circulating from outside. So this is
yes,
a 3D camera.
yes. 3D with a wide view means
Yes.
we are only now we are able to see like this. But if your eye allows you to see this side,
Peripheral focus.
yes, you
Yes.
you are able to see your what is happening here, right, left,
Yes. Yes.
in a curved fan. So you know that I am operating here. What is happening to the organ this side, what is happening to the organ that side is entirely under my vision.
Yes. So central
So
vision, it brings to your
cent-
central vision.
central, everything comes into one field
Yes.
and magnified. So you're not by any chance, even if it is 1% or less than 1%, you're not hitting any other sideways structures.
Yes. So the real operating room is like this, and I could see you sitting and doing the same. And what about the functioning of this legs, ma'am? What, like it is
Yeah.
like putting on the brake clutch and like that. So
No,
what is this about, ma'am?
left side, I have my foot is on the camera pedal.
Okay, okay,
So
camera.
because see, in laparoscopy, camera is held by a surgeon, assistant surgeon.
Yes.
Here, the camera is held by the robo and the movement is controlled by my left leg. And
Okay.
right leg, you see those yellow and blue pedals. If you
Yes,
can
yes,
see,
yes.
those are the energy. One is bipolar and one is monopolar.
Oh. And what does it do, ma'am? Bipolar and monopolar, like,
Monopolar for cautery, for
acha, quadri. Okay. So
cutting and
the nurses will not do any manual cauterization when,
nothing. Everything is
oh,
under my control.
so that's how
The
we tell,
nurse
like,
duty is to
less
only hand
bleeding.
the instruments and the assistant surgeon will put the instruments and take out. There
Oh,
is no third party working on the
involvement.
patient.
Yes,
No.
yes. It is only a central lead by the surgeon. And
Yes.
that's very wonderful. So yes, we going forward again. fever complications also, like now just we saw the bleeding and all that control is done by you, and faster recovery, and we our patient experiences after all this procedure and a very great intervention. What about the weight loss, ma'am? Like if at all patient person falling more than 35 BMI, so do they lose weight after this surgery and bariatric approach?
Yes, bariatric is a established way of dealing with morbid
Guidelines, yes,
obesity.
yes.
People lose ranging from 50 to 80-90% of their excess body weight. Excess body weight, not their ideal body weight. Their
Yeah,
lean body
excess.
weight doesn't go.
Yes,
Only the excess body weight goes, and it is a established thing.
yes.
There is no doubt in that I do the surgery and I don't lose weight. No, you will lose weight.
And
Uh,
with this surgical intervention, post surgery, they also have to follow the diet modifications, whatever you
yes,
advise.
yes.
Yes,
Right. We guide them to again onto a healthy eating habits and healthy diet, because most of them have not gained weight just by not eating anything. That we feel that we are not eating
yeah,
anything.
yeah,
But if you micro research on your eating, definitely we end up eating some 300, 400 calories, even if we think we are careful. And if you are not careful, definitely 1,000 or odd calories people end
will
up in
be
a day.
taking, yes,
And
indeed.
if they don't exercise and if they're not much active, then that all converts to fat.
So nowadays, ma'am, this one anti-inflammatory diet is also rising up slowly. We see a lot of actresses and all they are inculcating with those. So they are that is also. Would you advise or one must?
See, whatever I tell you, diet and exercise have their own limitations.
Yes,
We are talking at treating a disease. So we
yes,
are not movie stars where everything is superficial, and what they say today, they may not be following tomorrow.
yes, yes,
That's why it is like, now see, government is saying everywhere, don't fall for this prey that quick money or
yes,
quick result. See, that is the initiative. They should also do like that. Don't fall to fad information regarding your health,
yes,
because that is also a type of, we can say, cybercrime,
yes.
that people fall for and they don't get the actual treatment done, and then they fall prey to the disease, and no one takes responsibility that time.
Exactly. So
So it is
apart from patient preparation now is like a client who comes to you, pre-operative weight loss also is required, ma'am, before they proceed
no,
for
no,
the.
no, no.
No, no.
Pre-operative, not weight loss. We prepare them. Sometimes the super obese, those who are BMI more than 60, have
Yes.
big fatty livers.
Okay.
So and the liver is sitting exactly over the stomach where our surgery happens. So we have to lift the liver and do the surgery. So we give them a high protein diet so that the liver shrinks in size.
Yes. Oh,
So
that is
that
the
is for
knowledge. Oh,
preparing the
that
liver. If ultrasound says grade 3, grade 4 fatty liver
that is
in that
the
individual, we put them on a low calorie, high protein diet so that the liver shrinks at least by 300, 400 grams, so that it becomes easy for us to do the surgery.
and then accessibility is easier. Yes. Or the client might face some other additional criteria as well, ma'am, like failed non-surgical weight loss. I think you get to see all this. And what
Yes,
about
yes.
their psychological factor, ma'am? Do they easily accept? I'm sure you
Uh,
must be doing multiple time counseling.
Yes. See, one is, even if they're obese and are filled with diseases, they still think that treatment is going to kill them. Most of them. Even today,
Yes,
I said, see, then there is no need to set up hospitals. I can do so many other things.
yes,
Okay. So, hos- ultimately, treatment is to help you relieve the difficulties which the disability or disease is causing you. But
yes,
general public feel that treatment will harm me because they're obese, so they always fear something is going to happen to me. But with where centers which are dedicatedly doing bariatrics as a practice, we have lot of things for the safety of the patient.
yes,
We have big teams. We have good trained anesthetists. We have
Very good,
adequate
yes.
instrumentation
Yes.
and good pulmonology, cardiology support. So that is all taken care of. But we have to understand that for this obese individual, if they don't get themselves treated, they will definitely die one day
Yes.
because of the cardiac event or lung failure.
Or
So
yes.
that they have to understand that this surgery is a life-saving surgery, which will give them an absolutely new, healthy, fruitful life to undergo. But the
Yes.
general awareness, public awareness is still bad. And people always try to demotivate the person who is thinking of undergoing the surgery. So
Yes.
if we need to put more effort to put the misconceptions to rest in the general public.
Yes. Yes. And I know they meet you, they talk a whole lot of their doubts. Again, they go back, they, discuss again, the word of mouth, and then again they do a lot of secondary opinion with other hospitals, and then they do not drive any, right conclusion for themselves. Yes,
Mm.
having said so, main components also we spoke, and this is the really major. This is how the console. This is called, I think, console or one
Console.
console for surgeon.
Surgeon's console. This is
Surgeon
called surgeon
console. Yeah.
console.
So we wanted to give the viewers a very, very, light and the concise information. So because this is to begin with, we have, tried to put this points only, but Madam has already, done one video, but you can see those video. Now you can see all this information referred to social media platform for all our academic information. We publish in Facebook, we are in Instagram, we are in Twitter, we are in podcast, we are, the madam's articles and a lot of, health talks, even including patients testimonial good outcomes, that also we see in LinkedIn. WhatsApp methods are there, we can always have our surgeon very easily accessible. YouTube's also we see. I was just going through your advantages of robotic assisted bariatric surgeries and all. We wish to play one video, but this server could not support. So I wish all the viewers take down this information and keep sharing, and anything you can just get back to ma'am. And for more information about pre and post op, this is going to be a like series. So this is, we try to give you the knowledge of fundamentals, pre, intra, and post-operative care. Also, we will come back again in the next webinar series. Until then, keep learning. And ma'am, we wish to have your conclusionary note from your end. And with this, we end of the session.
Yeah, concluding, I will say that mainly for the nurses and all, always there is technology coming into any hospital, in any
Yes.
department. Get yourself updated, because ultimately you are the first attender to the patient when the patient is admitted in the ward. So you should sound confident about whatever technology is being used in the hospital. It could be robo, it could be anything. Okay. So please keep yourself well knowledgeful regarding these things, and definitely that will help a long way in soothing the patients. And also I would say that the propaganda regarding the safety of the various treatments should be done to the general public,
Yes.
to
Yes.
remove the wrong misconceptions in the general public mind. I think it should be done as a social welfare issue, that
Yes.
social responsibility issue, that we should continuously, instead of the non-medical people giving advices regarding medical treatments, I think hospitals should put effort
Yes.
to generate public interest and
Very much.
tell them clearly what is what, and so that they get the correct treatment of their problems.
Yes. Very productive statement, ma'am. Having said so, thank you for your very valuable session. We will again, reconnect with you in the next webinar series. And I
My
urge all
pleasure.
the viewers, thank you, ma'am. We urge all the viewers to stay tuned until next Thursday. Thank you. We end the session. Thank you, ma'am.
Thank you.